I am Dr. Kristine Kiat. I'm a board-certified pediatrician, and in my channel, I give you weekly videos for any question that you might have on a certain topic that would help you raise happy and healthy kids. You can also follow my Facebook page and Instagram, as well as subscribe to this channel. In this week's video, we are going to talk about deworming in children. What are these worm infections? Who are most at risk? And what are the effects on the body? We will also talk about signs and symptoms in children. And watch until the end because I will give you action steps on what you can do right now to help your child. So keep watching, alright? Deworming in children. Soil-transmitted helminth infections, or basically worm infections, are caused by a group of parasites or worms such as roundworms, whipworms, and hookworms. There are 2.3 billion people infected in developing countries. They are parasites, which means they need a host to be able to live, and their host is us, humans. So once they have established inside the host, they are provided with a constant supply of nutrients. Roundworms are the most common worm infections in the world and is rare in the US. They live in the soil contaminated by feces, and their eggs get inside our body through the mouth. Then infection is spread from person to person through contaminated feces. They can live in the small intestine for up to 2 years, and they can grow as thick as a pencil and as long as 13 inches. So, which children are at risk? These are people who live in warm, wet, tropical countries like the Philippines. Also at risk are people living in poverty. Children can get infected by playing in contaminated soil and putting their hands into their mouth. You can also get infected after eating unwashed fruits and vegetables grown in contaminated soil. These worms have harmful effects on the body. One is internal bleeding, which can lead to loss of iron and anemia. There can also be intestinal inflammation and obstruction, which might need surgery in severe cases. There can also be diarrhea, as well as impaired nutrient intake, digestion, and absorption. And now, what are the signs and symptoms you should watch out for if you're worried that your child might be having worm infection? More obvious sign is if you see any worm in their poop that look like earthworms, or if you see any worm coming out of their nose or mouth. More common signs if your child might be having belly pain, coughing, fever, and loss of appetite. If this has been chronic or going on for a while, your child might be having weight loss and failure to grow. And now, how do doctors diagnose this condition? Your doctor would obtain a complete history asking for your child's signs and symptoms. The doctor might also ask for the travel history and where your child lives. And also, the doctor will then do a complete physical examination and send his stool to the lab and to examine it. Now we go to action steps, my favorite part on what you can do right now to help your child. Action step 1, hand washing. It is very important that you do it and teach your child how to do it. Wash your hands with soap and water after being outside, after using the bathroom, and before eating. Action step 2, make sure to thoroughly wash fruits and vegetables. Action step 3, be aware of risk if you're going to developing countries. And the last action step 4, or deworming. This is the most important step. According to the World Health Organization, they recommend preventive chemotherapy, otherwise known as deworming, as a public health intervention. It is preventive treatment given annually or biannually, and the target population are children living in developing countries. These are young children aged 12 to 23 months, preschool kids aged 1 to 4 years old, and school-aged children aged 5 to 12 years. So, if you live in an area with a high prevalence of worm infection, ask your public health officer or your doctor about deworming. Alright, that's the end of our video. I hope you learned a lot. Thank you for watching. Hi, I hope you enjoyed the video. I am here to provide support and help you raise happy and healthy kids. If you have any questions or if you want to suggest a topic, just type in the comments below. And don't forget to hit like, subscribe, and the bell button to keep posted. Alright?